Hello, everyone. We are recording our initial draft of our presentation. This is for everyone who isn't able to see it. We're going to let you know how we're going to let you know how we do, and then hopefully we'll get some feedback from you later. Kelly Green, by the way, Team Q Consulting. Get my timer on real quick. Okay. All right. All right. Are y'all on mute?
Oh, no. I mean, you can do it.
All right, cool. All right, Team Q is ready to begin. Good morning to our distinguished judges, members, and partners of Johns Hopkins Medicine. We represent Team Q Consulting, where the Q is for quality. Here's our agenda for the day. First, we'll give you an overview. We will then discuss to you the competitive landscape and industry. We will then make our proposal and supplementing financial information, and then we will offer some risks and next steps, and then we will open the floor for any questions. We know that cancer volumes at Sibley Kimmel Cancer Center are expected to increase substantially in the National Capital Region, or NCR. You will be looking to expand your market share by 10% to account for this. In addition, your nurses are staffed at full capacity, and insurers are now changing their reimbursements, favoring outpatient and home services as opposed to traditional hospital settings. Sibley Kimmel Cancer Center's current operation is not sustainable, but we at Team Q Consulting have the solution for it. So as an overview, we propose a solution to you that captures 100% of the excess patient load, offers a competitive advantage, is cost-effective, and can be fully functional in only 7 months. From a volumes perspective and accounting for the increase in the market share, we project that 1,945 patients cannot be handled currently by Sibley. In addition, this means that you're missing out on $228,000 worth of profits, and patients that need infusions may delay or forego care altogether. So here we have some patients who would be unaccounted for with the volume increase of Sibley. Beth is a paraplegic retired professor who was diagnosed with gastrointestinal cancer back in 2015. It's been difficult for her to schedule infusion follow-up visits at Sibley due to full volumes, and she was also unable to arrange home infusions. Carlos is a sophomore at Johns Hopkins University in Baltimore, Maryland. He was recently diagnosed with melanoma, and apart from being a student, works a part-time position at a local retail store to make ends meet. And lastly, we have Daryl, who has been living with genitourinary cancer, specifically prostate cancer, for 3 years. His 3 children are a staple of his life, and he wants to spend quality time with them. With Sibley's volumes being at full, this throws a wrench into their decision-making process to receive infusion therapy. In addition to Sibley, your other cancer sites are the newly renovated Green Springs Station, which has 13 chairs for infusion, and the Johns Hopkins Home Care Group, which only offloads about 15% of current volumes at Sibley. Even so, the market share increase still remains to be captured for infusion services. I will now pass it over to my colleague, Omar, who will go into more detail about the industry and solution. Omar?
Thank you, Caleb, for that introduction on the problem that Johns Hopkins is facing. This is the status quo of cancer services in the NCR. Infusion is offered in both inpatient and outpatient settings within hospitals, ambulatory care centers, and through home infusion. Now, because of COVID-19, there have been innovations in the delivery of oncology services, such as private rooms for infusions, drive-through injections, and telemedicine use. On the map provided, you can identify Sibley Kimmel Cancer Center, which services the DC area, and Green Springs Station, which services the Baltimore area. They are both hospital-based and independent competitors that lie in between and around the Johns Hopkins medical locations. Some of the major ones are marked on the map, which all have both outpatient infusion and home infusion services. Inova is building a new cancer center with 48 chairs for infusion, while Georgetown offers a 6-day bed hospital and a breast cancer van to transport patients to mammography screenings. We know that oncology services will continue to expand in the next few years because of the NCR housing one of the highest cancer incidence rates in the USA. This can be attributed to baby boomers in the region reaching a high-risk age for cancer incidence, also meaning that more of them are eligible for Medicare. In addition, payers like Cigna and Anthem have led the way in changing reimbursement models to favor lower cost settings like home care services and ambulatory care centers instead of a hospital model. This all leads to a unique opportunity that can be captured through Fuse Motion. What is Fuse Motion? Fuse Motion is a fleet of 16 mobile infusion clinics that will assist Johns Hopkins in the delivery of care for oncology patients. In addition to outpatient and in-home infusion, patients will now have the choice to use a mobile option that makes follow-up IV infusion appointments more easily accessible. Fuse Motion will contain the staffing and equipment needed to provide infusion services in a cheaper setting. This option of care will also be reimbursed by payers. The major advantages for patients with Fuse Motion are that it will be functional after business hours and on weekends, so patients can have greater options for appointments to receive infusion therapy. An advantage that JHM enjoys is the fact that it is a first-to-market low-risk investment. For example, Phase 3 of Green Spring Station cost $80 million to build, and Fuse Motion is projected to have $3.2 million in capital costs. Operating after business hours and on weekends will cost Johns Hopkins Medicine significantly less money as well. Most importantly, Fuse Motion will be able to triage the volume that Sibley will not be able to handle. I will now pass the explanation of Fuse Motion on to Mary, who will provide more details.
Thank you, Omar, for the introduction. As shown on the screen, we have a layout of a single Fuse Motion clinic, which contains adequate spacing for patients during treatment with dividers to prevent the spread of COVID-19 and to give patients privacy. As shown to the left, the woman pictured is sitting on a comfortable recliner while obtaining infusion therapy and maintaining a conversation with the nurse in a Fuse Motion clinic. Our strategic nursing schedule allows Fuse Motion to provide dedicated one-on-one care teams. In addition, shorter commute times, wheelchair accessibility, and physician telehealth checks are all aspects of the patient engagement experience. Fuse Motion is committed to promoting the digital platform by allowing patients to make appointments online through the addition of a Fuse Motion appointment booking section to the homepage of the JHM MyChart app. Considering that Sibley oncology nurses are staffed at full capacity, we have come up with an efficient model for Fuse Motion by partnering with MBI Health Services, which is a local health staffing company in DC that prides itself on similar values to JHM. MBI Health Services will provide nurses certified by the Oncology Nursing Certification Corporation to deliver infusion services to our patient mix. Our full-time nurses will work 36 hours a week, while our pro-retina nurses will work 20 hours a week in relief. The average infusion length will be 3 hours, and each Fuse Motion clinic will be able to take on a minimum of 6 patients a day, which leads to a conservative estimate of 2,016 visits per clinic per year. Each Fuse Motion patient will have a different number of visits, which is dependent on their infusion treatment and their dosage schedule. This will allow Fuse Motion to address the excess of 1,945 patients who have multiple visits per year. In addition, each Fuse Motion has the capacity to service the 70-mile NCR radius with 12-hour shifts on Monday through Saturday and 8-hour shifts on Sunday. We've identified locations at various community centers with estimated cancer patient numbers in the most cancer-populated counties in the NCR. Fuse Motion will be parked in their parking lots for patients to arrive and receive care. Of course, these won't be the only locations, but this just gives you an idea of the places we expect to visit the most. Now I will pass over the presentation to Omar, who will provide an overview of the solution and financials of Fuse Motion.
Thank you, Mary, for further explaining the Fuse Motion concept. So, as you can see, Fuse Motion is a quality solution that will allow for the capacity issue to be addressed in an accelerated fashion. Just as a reminder, the benefits provided to Johns Hopkins Medicine are a first-to-market product that is also cost-effective. Here's the profit that Fuse Motion will enjoy. There will be a profit of $228,000 in the first year. Although it is stated in the slide that Fuse Motion will yield $728 per visit, the reality is that we will yield a profit margin of $7.28 per visit. We will be reimbursed from the sale of medications by Medicare and other payers through the payment of the drug's average sale price itself with an additional 6% margin. We estimate that Johns Hopkins Medicine will be able to buy drugs in bulk at 86.5% of the average sale price, which is a very conservative estimate considering the volume of cancer patients that JHM serves. Costs are accounted for, and this will have an initial investment of $3.2 million and an ROI of 6.99% in the first year. I will now pass the presentation back to Mary to discuss the communication plan to patients.
Thank you, Omar. To communicate the availability of JHM's Fuse Motion services, the front desk staff and clinicians will pitch Fuse Motion to their patients. Beth is in a wheelchair, and her niece drives her 30 minutes to Sibley for each infusion session. With Fuse Motion in Fairfax County, her niece will only drive Beth for 5 minutes to a clinic. Carlos has a busy student schedule, and even though he started treatment at Sibley, the next available appointment wouldn't be for another 2 months. Fuse Motion fills the gap by providing sooner appointments along with Wi-Fi access for Carlos to do his homework during treatment. Daryl drives his children everywhere for hours on end, and Fuse Motion will provide a shorter commute time for him to get treatment in between stops. How long will Fuse Motion take to get off and running? Considering that cancer prevalence rates are rising in the region, Fuse Motion should begin being implemented as soon as possible. May is when we recommend that JHM begin communicating with key stakeholders about the launch. By October 1st of 2021, we hope to roll out Fuse Motion into the NCR to accommodate this rapid growth in cancer infusion usage, which will help Sibley offload some of their current volumes and continue to increase JHM's presence in the infusion market. How do we plan to measure our success? By year one's end, we expect the fleet of Fuse Motions to have performed at least 30,000 visits in the NCR, which will account for 9% of volumes from Sibley. Next, we expect Fuse Motion to generate $35 million in revenue by October of 2022, which is only a year after launching. Lastly, we want our allied nursing staff with MBI to continue providing quality care to patients in Fuse Motion. We want to maintain a nurse turnover rate of less than 10% each year so that patients can value the consistency of the one-to-one patient care teams. I'll now pass over the presentation to Caleb, who will wrap up.
Thank you, Mary. For next steps, we suggest implementing additional nurse scheduling administrators to better position current Fuse Motion nurses and add more for volume increases. Secondly, to reach less cancer populous areas, more research to additional counties that can be added to increase infusion volumes and profitability should also be done. Next, to promote the Fuse Motion brand, you should look for additional marketing opportunities that will further establish yourselves as the first to market mobile infusion service. Lastly, as cancer prevalence rates continue to rise, you may look to add more Fuse Motion clinics in the NCR if appropriate. Additionally, we've recognized risk and potential alternatives. First, while the NCR being the most cancerous region in the United States, several competitors, including Georgetown Lombardi and Inova Shar, will also be attempting to expand their infusion services to capture more of the market. We also know that patients may have a preference to receive infusions in their own homes or in traditional on-site settings. And lastly, we recognize that anaphylaxis reactions may occur for some patients, but protocols are in place to mitigate this. As alternatives to Fuse Motion, we kept in mind the possibility of renovating and expanding Sibley by adding more infusion chairs and staffing. This would be a more strenuous investment as seen with the Green Spring Station 2019 expansion, which cost $80 million. Secondly, extending Sibley's normal business hours to 8 p.m. could also accommodate the increase, but may lead to higher costs and employee burnout. And lastly, you could consider purchasing multi-story office buildings, utilizing the lower levels, and then leasing out the upper levels to smaller practices, which has a whole bunch of high upfront costs to begin with. So to account for the projected 10% increase of the market share of patients in the NCR, Fuse Motion will give patients like Beth, Carlos, and Daryl an opportunity to receive necessary infusions that brings the care to them and provides them with the amenities that make them feel comfortable. Fuse Motion is your first to market mobile solution that captures the excess patient load, offers a favorable return on the investment made, and can be on the roads in as little as 7 months. Thank you so much for your time and consideration. We will now open up the floor for any questions.
All right, how long was that?
1441. Oh, shoot, I almost dropped it.
Yay.
1441, dude. We're in good
Yay.
time.
Cool.
Great. Great.
I'll put it back on, don't worry.
It's okay. How do y'all
Guys,
feel?
I'm gonna switch the 5-year projection. I was thinking that 10%, which is the growth rate that Mary and I agreed on, maybe too much. So I'm gonna make it a 5% growth rate.
That's fine.
Okay.
That's fine.
Cool.
Yeah. All right, let me start recording.